Hi everybody, my name is Ron Iverson. I am the medical director at the Kehl Diabetes Center here at Finley Hospital in Dubuque. And I'm also an endocrinologist with Dubuque Internal Medicine. And it's my pleasure to visit with you, talk about what I think might be some interesting topics in diabetes, and maybe more specifically, as an endocrinologist, some of the common questions that we receive with respect to diabetes. And maybe one of the most interesting ones that I receive is, Doctor, is there such a thing as borderline diabetes? And as one of my professors in medical school once said, well, there's no such thing as borderline pregnancy. You either have it or you don't. And to some extent, that's true about diabetes, but actually we can define it a little bit more accurately than that. So the first thing we should ask ourselves, well, how does one define diabetes? And we use a measurement called blood sugar. The range of blood sugar actually up to normal ranges 100. If you were to do what we call a fasting blood sugar, it should be less than 100. And that applies to if you're measuring values before meals as well. But we expect blood sugars to rise a bit after a meal. And in a normal individual, that number can actually go up to 140. We define diabetes actually when a fasting blood sugar on more than one occasion is above 126. So if an individual has more than one value above 126 fasting in the morning, that individual has diabetes. We can also do a test called a glucose tolerance test, where we have you drink a fixed amount of a sweet sugar solution, specifically 75 grams of sugar, and then we measure your blood sugar 2 hours later. And again, that value should be less than 140. If it's above 200, then that individual also has diabetes. So you can see there's a little bit of a range in between what we consider normal and diabetes. And this gray zone that we referred to is called impaired glucose tolerance. So if a person has a fasting blood sugar between 100 and 126, or a 2-hour post-challenge blood sugar between 140 and 200, that's a condition that we call impaired glucose tolerance. And so some people might refer to that as borderline diabetes, and that's sometimes where that terminology comes from. There's also some important value that can be obtained from these values that are in this, again, gray zone or borderline zone, the term that we now are referring more to as prediabetes. And as you can tell from the term, that has some implications as far as a person's risk for developing diabetes. Many people ask us, is there a cure for diabetes, or why can't we prevent diabetes? And although, for example, in type 1 diabetes, that cure that we're looking for is a bit elusive, we've actually been able to find some valuable information for individuals with type 2 diabetes who have this impaired glucose tolerance or prediabetes. There have been a number of studies which have shown that if an individual who is at risk for developing diabetes, by virtue of these blood sugar values we just mentioned, fasting values between 100 and 126, challenge values between 140 and 200, and they may have some other risk factors, family history, being overweight, already some certain types of cholesterol abnormalities. We've been able to find that if those individuals can exercise regularly, lose a modest amount of weight, so use a medical nutrition program and lose some degree of weight, we can actually decrease their chance of developing diabetes by over 50%. There's also some additional information on types of medications that we might be able to use as well. But really the best approach is trying to take a more active role in lifestyle modification, being more active in losing weight, and you can make a significant difference if you're at risk for developing type 2 diabetes. What are some of the things that are available that can be of assistance to someone who may be at risk for developing diabetes, or for that matter, someone who has diabetes and wants to do better? What are some of the things that they can do to help improve their control? And here in Dubuque, we're very fortunate. We have the Kehl Diabetes Center available to us. And at the Kehl Diabetes Center, we have a combination of nurses, dietitians, who all have special training in diabetes care. They're called certified diabetes educators, as well as the additional assistance of individuals in the field of physical therapy, pharmacy, social work, all form a very active team at the Kehl Diabetes Center that can be of great benefit from individuals from one end of the spectrum who may be at risk for developing diabetes, maybe have some mild abnormalities, all the way up to individuals who have diabetes and want to take advantage of some of the latest technologies, whether that be intensified insulin programs, insulin pump therapy, or some of the new continuous glucose sensing devices which are now available. So I would encourage any of you, if you either have diabetes, have family members with diabetes, at risk for diabetes, These are all individuals that talk with your physician, and they have the ability to refer you to the Kehl Diabetes Center and take advantage of some of those resources. You still maintain your relationship with your primary physician. We consider that very, very important, but it also allows you access to individuals who have great interest and great expertise in diabetes to help you and your family members accomplish some of the goals that are so important in diabetes management.